liver disorders. So I have been learned from Dr. Chinmay that most of the participants are doctors. So you are practitioners. So I'd like to try to see that what best I can do in respect to the discussions related to that of the liver conditions as in Ayurveda. So before we start with the presentation, let us have a salutation to the Lord Shiva, who is the authority for the Raskalpas. And also, he himself is a Agni Tattva. Why I'm speaking about the Agni Tattva now, whenever we are discussing about a salutation program, as well as when we are discussing some disorders of the liver. Agnisthana is said to be the Grahini, the duodenum in Ayurveda, no doubt in that, but still the metabolic factory of the body is the liver. And it is the place where the whole of this metabolism and other aspects related to the homeostasis of the body to maintain in a normal function is going on. Without the organ, the whole of the metabolic industry is lost in your body. The whole chemistry is being lost in your body, specifically with many of the aspects in the individual. So on this particular grounds, we need to salute to the Lord Shiva for two reasons. One thing is about the Raskalpas, who is a pioneer and who is a founder of the Rasa Shastra, one thing. And the second thing is about he himself is Agni Swarupa. He is a person who is maintaining the homeostasis in the universe. So on that grounds, with this salutation, we'll move on to the next slides. So whenever we discuss about the treatment modalities, might be many of the topics which I'll be discussing with you people in one or two sessions, at least for the next 1 hour today, might be it has been dealt in a similar pattern or in a different pattern by the other eminent scholars or the teachers who have taught you all this time in the past 15-20 days, whatever the program is going on with. And that's a wonderful aspect to know about this particular issue. So it's only my guidelines. It's something like seeing the tip of the pyramid from various angles. Everyone wants to see the effects of it, but it's a different angles. It's not like somebody else are wrong and somebody else are only right. Everyone could be right, but depending on your availability, you can definitely go for the choosing of which plane or which view of the pyramid you would like to see. So with this short introduction, I would like to step in directly into the treatment modalities. The initial first slide, what I'm going to present here is about, in general, what is the treatment modality in Ayurveda. So basically, I try to understand the treatment modalities in Ayurveda in 4 different ways. The first one is to maintain the swasthya, because Ayurveda speaks about prevention is better than cure. So, swasthya swasthya rakshana mathurasya vikhara prashamanam, or the prime mottos. So first half of the treatment is swasthya swasthya rakshanam. To maintain the health of an individual, you are supposed to take with the nitya rasayana sevana. You have to follow the dinacharya, rutucharya, palana, etc. as per the swasthya. And nitya rasayana sevana, being a rasavaidya, I would like to go with the nitya kajali sevana, nitya swarna sevana, because nityam swarnam is a reference what you have. You're supposed to take gold every day. You're supposed to take mercury and silver every day in the form of kajali. In case if you want to appease, at least me, I'm taking gold with parada and gandaka at least from past 20 years. So, and most important phenomenon is it tries to maintain your health in a homeostasis. It doesn't say like a person who is taking mercury, a person who is taking gold in the form of a Swarnavasma or in the form of a Kajali or in the form of a Rasasindura will not die, or he will not at all fall ill. No, it's not like that. It tries to say that your immune system is so active. It tries to say that your normalcy in the body is being so well maintained. You have a Kala Marana. We Ayurveda people don't want to have a Akala Marana. We want to see like a person have a normal death scale. So on that grounds, you're supposed to take with the preparations like that of Swarna, Parada and Gandhaka. And these preparations are said to be very important once you come into the clinical practice. Why they are turned to be very much important in the clinical practice? So as you people are from Ayurveda, you can understand the concept of samskara. Samskaram Gunantaradhanam. So whenever you have this concept of Samskaram Gunantaradhanam, you happen to take this Kajali. Who should take Kajali? Kajali in the sense equal proportion of Parada and Gandhaka, mercury and sulfur together. Triturated for nearly 120 hours, which makes it a sort of a black colored ingredient called as Kajali in Ayurveda. Might be it's a combination of HGS in modern terms, in form of chemistry. So this particular thing, it's been taken. I say it's a mixture. It's a mixture, and people do take it. And because of the Guru Guna of Parada and the Sara Guna of the Gandhaka, it is Guru and Sara which causes Atisara in an individual, especially the one who is having the Mrudu posture. Anyone who are having constipation by nature, anyone who are having some complaints regarding the liver complaints, where usually we expect to go for a Anulomana Kriya. See, most of the liver pathologists, at least you people have gone from past 10 or 15 days, like definitely person is having some sort of illness regarding to the liver, we expect Deepana, Pachana and Anulomana substances. Of course, Rasayana is there. So Anulomana is also part of treatment in most of the hepatic conditions. So when you expect the Anulomana substance, then you're supposed to go with the Kajali Sevana. Kajali is having Parada and Gandhaka, which is having Guru and Sarakuna, which it takes the substances downwards. It gets the Apana to Etasthana. It gets Vatha to Etasthana. By getting this Vatha to Etasthana, most of the doshyas of the body, most of the dhatus of the body turns out to be into a normal posture. Turns out to be in a normal posture, because the main culprit is most of the times the Vata, because it is one of the substance which moves Pitta and Kapha, which moves or which tries to take Pitta and Kapha to a different area. So Pitta Pangam, Kapha Pangam, Pangave Maladatava, Vayonetra Nitra Gachante Tatra Gachanti Megavat. So with this particular reference, you're supposed to say that always have a hold on Vata. So this particular Kajali Sevana, especially in the conditions of the liver, you are supposed to give them as a Nitya Rasayana Sevana, by which it happens with Anulomana Kriya, by which you are maintaining the individual's Agni, because Gandhaka which is present in that is also Agni Tattva. It is going to definitely protect the patient from the Agni, or it is going to generate the Agni, or it is going to balance the Agni in a proper way. So with this particular way, you are going to have a sort of a normalcy in your Agni, normalcy in the form of Anulomana. So this is the Swasthapalana whenever we are speaking specifically to the topic liver pathology. The next question comes in case if somebody of you might ask me, what about for the person who are with a Mrudu posture, by taking Kajali because of the Guru and Sarakuna, he happens to land up into Atisara. He tends to have a sort of a excessive apana prakriti. He happens to have a sort of anulomana kriya in extensive way, which might disturb the patient, or sometimes the patient might land up into a borderline conditions like that of Atisara. Then what to be done? So for those people who have those complaints, like anulomana is prakrutita more, then for them we try to see that we add rasasindura instead of paradandanda in the form of kajali. We add rasasindura, or we add rasagarpa potali along with swarnavasma and try to give it to the person as Nitya Rasayana Sevana. Wherein you have a sort of a grahi property. You can go for even rasaparpati, which is having a grahi property. Because of the Agni Sanikarsha, because of the Samyoga with the Gomaya, Kadilipatra and Agni Sanikarsha, there is a Samskara and there is a Samyoga, by which the Guru Guna is being converted to Lagu Guna, the Saraguna is being converted to the Grahi Guna. So Lagu and Grahi will cause Ama Pachana in an individual, which causes Agni Vardhana, and later on it causes Grahani Nasha. So by which the person is being very well balanced. So on this grounds, for the people who are having the disorders of the fire, gastric fire, for the people who are having the disorders of the gut, for the people who are having excess of anulomana, for the people who are having the problem with the excess of apana prakriti, you are supposed to prescribe the same swarna in the form of a parpati or sindura preparations or rasagarpa potali. So these are a few of the basic essentialities for the normal maintenance of the liver or the liver related issues. This is one thing. Second question comes, why swarna? If it is Kajali, okay, fine, somehow we could be having a logical answer in this. But what about the swarna? See, one thing, Gandhaka is Deepana Pachana, it is Agni Tattva. Parada is one of the Shreshta Rasayana and also Sukshma Srotogami. It takes the substances to the minutest channels of the body, sees that your gastric fire is always been well maintained, your metabolic industry in the body has been very well balanced because you are having a Nitya Parada Sevana. The third thing is Vaiswarna. One thing Acharya Sushruta, while explaining about the concept of Rakshobnagana in Uttarasthana, he explains that every individual should take Swarna in case he wants to protect himself. That is, whoever wants to have a sort of a protection from many of the disorders or many of the calamities, which is in respect to the health, he is supposed to take with that of the Swarna Kalpas. This is one reference because Swarna is Rakshobna. The second concept, why we need this particular one? We need Swarna just because of the reason you have only 3 drugs in Ayurveda Shastra, which is Ojo Vardhana. What are the 3 factors? One thing is the Swarna or the gold, second thing is arsenic or the Haratala, third thing is Panna or emeralds. So these 3 are the substances which is there in your syllabus, which can increase the Ojas very significantly. So added to this, what all did you do by giving this Nitya Kajali Sevana with the Swarna Basma? It happened Deepana, Pachana, Sukshma Srotogami, Ati Rasayana, and Ojo Vardhana. I think 99.9% people will be very safe by taking such combination. They are totally fine. Only thing is you need to judge for your patient whether the gut is with which might need Kajali or the gut might need a Parpati or a Sindura Kalpana or Potali Kalpana. The combination is again mercury and sulfur. There is no alteration in the ingredient. So this is particular way how we are supposed to take with that of the Nitya Rasayana Sevana, with that of Parada Gandaka and the Swarna. So this is one such way which you would like to get your attention to take with the Rasayana Kalpas, or to see that your metabolic factory, that is the liver in the body, sustains a swasthya for a long time. In case you want more Devana quality. So what you need to do might be it's a temporary phenomena due to some Nidana Sevana or some other reasons. The person is suffering from Mandakni, which might make him to land up into other systemic illnesses because Sarvan Rogo Mandakno. So on that particular grounds, we can add some other substances. Might we can add some amount of Chitraka, might we can add some. The best part is Jiraka. That is a very safe drug, and you have Jira at home. So you can take small concentrations of Jira, mix it with this Paradagandaka along with Swarna and ask him to take it every day, which acts as a best rasayana, wherein you can expect more amount of Deepana quality. So similarly, we can have lots of permutations and combinations with the set of drugs which you people know about the qualities, which are being explained from the textbook as it is. But this is a combination which I would like to get your attention for the Swasthya Palana, especially with the regarding to the disorders related to the liver pathologies. The second protocol is about the Shroto Dushti Chikitsa. So here the example which I have quoted is the Pranava Shrotas for you to understand, so that we can have a discussion on 2 Shrotases. So Pranava Shrotas, so any person who is having a disorder of the Pranava Shrotas, like you have the Shwasa Chikitsa, then the person takes some drugs like Shwasa Kuthara Rasa. Might be his Pranava Shrotas is being repaired. He's having some Kasa Shwasa, he takes the Shwasa Kutaras. Similarly, you have the pathologies related for the liver. So liver pathologies are being related with the Raktava Shrotas. So most important phenomena is whenever you have the disorders of the Raktava Shrotas, his liver is being affected. Why? Because Raktava Shrotasam Moolam Ekrut Pliho. So Ekrut is one such organ which is a root for the whole of the Raktava Shrotas. I say many times whenever you're dealing a patient suffering from Kushta, consider his liver. A person, whenever you're considering a condition with hemopathic system, consider his liver. A person who is into metastasis in malignancies, consider his liver. In all these pathologies which is being related to the hemopathic system or the Raktava Shrotas, try to see that always you focus on the liver. Why? Because Raktava Shrotasam Moolam Ekrut. So you need to see that somehow the ekrut of that particular patient is being very, very well equipped. The shrotas of the whole of the Raktava Shrotas is being repaired or rejuvenated if the moola is normal. But in case due to some reason if the moola is being affected, then the whole Shrotas gets derailed. There are lots of pathogens which drags into the Shrotas and makes it more and more pathetic. So it should not happen in that particular way. So what did we do? We tried to see that in case if only the Shrotas has been affected, we try to see on this particular grounds, try to give them with a specific drug, which is related, as you see here on the slide, like in case a person suffering from Kasa Shwasa, he takes a Shwasa Kutavis. That is Shroto Dushti Chikitsa. Similarly, for the Raktavashrotas, a person who is been suffering from some skin ailment, a person might be suffering from psoriasis or something like. You might have to, because Kushta is also related to the Raktavashroto Dushti. So in case if it happens like the person has been suffering with a Kushta Vyadhi, like might be it is a psoriasis case, you try to plan out to give him some Talakeshwara Rasa, Manjishtadi Khada, you give him some Gandhaka Rasayana or anything like that, which is a treatment protocol for the Shroto Dushti Chikitsa. You're treating the Kushta, that's all. You're not treating with respect to the Shroto Mula and all. So this is the second line of treatment what we can do for most of the patients when it is with a recent onset. In case if you have a patient who is suffering from a Kushta Vyadhi from past 15 days, 10 days, 1 week, whatever, then Shroto Dushti Chikitsa is more than sufficient. It is more than sufficient. But in case if it happens like it goes deep rooted, in case if it is chronicity of the illness, might be it is because of the Dirgha Kalina Vyadhi, the Vata Prakopa is an essential component, then you have to consider this factor, the third treatment protocol, that is a Shroto Mula Chikitsa. Here on the slide I have shown Rudhya drugs are being administered in the disorders of the Pranava Shroto Vikara as Abrakavasma in Shwasa. See, Shroto Mula Chikitsa should be something like, always try to see the Mula is being protected, the organelle is being protected, the organ is being protected. Raktava Shrotasa Mulam Ekrut Pliho. Try to see always that Ekrut is being protected. Even though the person is suffering from some Gulma, the person is suffering from Kushta, the person is suffering from some Kasa Shwasa, the person is suffering from Jivadara, the person is suffering from Raktapitta, try to see that his liver is always being protected. So this is as per the grounds of Ayurveda. Similar is a phenomenon whenever you try to see with multiple systemic involvement. Whenever there is a chronic liver pathology, might be all of you people would have already come across these pathologies. Many times whenever you have multiple systemic involvement, the root cause is the liver. Most of the times this happens. Multi-organ failure, the triggering cause is the liver pathology. Most of the times. It's not like it's not a SOP or it's not a hard and fast rule, but most of the times it is liver. Say for example, a liver failure can have its impact on the brain. A liver failure, or it can have its impact on the various systems of the body. It can have its impact on the conditions like that of the kidney and the adrenal gland. It can have the impact on the liver. It can have an impact on the heart, the bone marrow. It can have its impact on the various organs, including the lungs, heart, and other vessels, blood vessels in the body. So why this particular phenomenon has been seen? This particular phenomenon has been observed just because of the reason multiple organs are being interconnected, just because of the reason as per Ayurveda, Yakrut is also a Koshtanga. All these organs, including the heart, lungs, Yakrut, everything are being related to the Koshta. They are the Koshtangas. Anything, any disorder related to the Koshtanga is being reflected in some other organ as well, because the Shroto Mula is being affected. Here it has been affected. So what should be your treatment protocol whenever the Shroto Mula is being affected? Shroto Mula Chikitsa. One thing is either in the Dirgha Kalina Vyadhi, when the Shrotas has been repeatedly insulted with various systemic illness, then even though the person doesn't have liver pathology, you're supposed to give him some Ekrut Uttejaka or the drugs which can protect his liver. So this should be the treatment modality. Might be, say for example, the person is been suffering from Kushta. Kushta is related to the Raktavashrotas. You might be having a question mark like, why I am dealing with the chapter of Kushta now. I'll go into deeper parts of Kushta today, just because of the reason it's related to the Raktavashrotas, and Raktavashrotas Mula is Ekrut. So a person is suffering from some psoriasis, pemphigus vulgaris, or any of such systemic illnesses related to the dermatological conditions. If it is recent onset, it is fine. In case if it is chronic onset, then you are supposed to understand the grounds of liver. and try to say that you resolve the complaints of the liver, or else this kushta will never disappear. You might give him some panchatikta, you might give him some gandhaka rasayana, it will get palliated. But he has more episodes of it. Might be after 1 month, might be after 3 months. Again, a small amount of Vidana Sevana, again the conditions will evolve. So in case if you don't want either of these conditions to evolve, you are supposed to energize the Shroto Mula. Whenever you are cut shorting the shoot of the plant, it's always secured that the root of the plant is being well protected. In case you cut off the root, then the whole of the shoot will get totally dried up. So the same phenomenon happens in the body as well. The mula, that is the liver or the ekrit, is being explained for the Raktavashrotas. But where is the terminal part? That is the other end of it. One end is ekrit, the other end is all over the body, all the blood vessels. And the another problem dealing with the liver pathology is because Raktavashrotas, wonderful, it is having the mula as Hridaya. But most of the time it happens like Rasa and Raktavashrotas are together, because they travel together, they behave together, they are almost like together. Some of the acharyas have told the Rasavashrotas attains a red color and becomes Rakta. So it is very much related. Rasa and Raktavashrotas are being dealt together. They are to be dealt together. And many times Rasavashrotasam Moolam Hrudayam Darshatamanya, Raktavashrotasam Moolam Yakrit Pleho. So you have any of the chronicity of the Ekrit Roga, it is being reflected even in the Hridaya because it is concerned. It is a sister concern because Rasa and Rakta are together. In case if a person is having a chronic cardiac complaint, he tends to have a complaint of the liver pathology in future. Say, for example, the person is having a hypertension. Eventually, it has landed up into some other pathologies and he has landed up into portal hypertension, which is related to the Rasavashrotas initially because it is the pumping action is because of the liver, heart, wherein the force exerted by the blood on the walls of the vessels is called as hypertension or the BP, blood pressure. And its reflection in the portal vein, it is called as a portal hypertension. And this portal hypertension, once it has any variation, it causes some Ekrit Vyadhi. It causes some disorders of the liver. So you can understand the cycle. You can understand the cycle, relation of the Rasavashrotas to that of the Raktavashrotas. Rasavashrotas Mula, Raktavashroto Mula. So it is being interrelated. So we are supposed to understand, in case if you have any of the chronicity of the illnesses, either of the Rasavashrotas and Raktavashrotas, if you are able to demarcate the condition between, you are sure like only the Rasavashrotas is affected and Raktavashrotas is not affected, or you are sure about only the Raktavashrotas is affected and Rasavashrotas is not affected, then you can treat the respective Mula. Or else, if you are in a question mark, like whether it is Rasa or Rakta, then you are supposed to treat a cardiac as well as a hepatoprotective drug to an individual. Whenever you have these shrotas related to the liver or heart is being interrelated. So my choice of drug whenever you have those conditions is something like Nagarjuna Brarasa. Like you have the Loha Basma, you have the drugs of combination like the Tamra Basma. Tamra Basma is one such drug which acts on the heart, which acts on the liver, which acts on the hemopoietic system, the Raktavashrotas. Similarly is the Loha. Loha Basma acts on the Raktavashrotas, Loha Basma acts on the liver, Loha Basma also acts on the heart, but it is moderate. But Tamra is extensive, which is a higher end. There are Sukumara, the lower end. You have the drugs like Pravala. So Pravala Pishti, which acts on the heart, which is cardioprotective, it acts on the liver, it acts on all the Rasa and Raktavashrotas. It is a Pitta Shamaka Rakta Sanjanana Dravya. It is a very, very ideal drug to be practiced in many clinical conditions. So you have three drugs. One thing is about the Tamra at a higher end, Loha at a moderate end, and Pravala at a lower end. So whenever you have these disorders of the Rasa or Raktavashrotas, you are unable to demarcate them, then try to say that your prescription will have either of these three. One thing is copper, one more is iron, the third one is a coral. So it should have either of these three components as an essential ingredient in your prescriptions. So this is about the Shroto Mula Chikitsa and its importance in the clinical practice. And that is how we select the drugs related to the Dr. Shastra to such a clinical pathologies wherever it has been related to. You want to become more specific, you want to go deep rooted into this concept. In case If you want to go into deep-rooted, then we can have more discussions. In case if you want to go more deeper, like which are the other conditions where I'm supposed to give only Tamravasma whenever I have the disorders of the liver? Whenever, which are the conditions where I can give Lohavasma to the person? Which are the conditions wherein I can moderate the Tikshnata of the Tamravasma? What are the conditions I can increase the potency of Lohavasma? What are the conditions which wherein I can see the Pravala Pishti can become Ushnavirya? Normally, Pravala Pishti is Shitavirya, which is usually given. But how can I make it into Ushnavirya? They becomes into the pharmaceutical sites. So in case if you people are interested, might be in the last, by the end of today's discussion, or might be in the next session, we can discuss about this concept. Only in case if you people are interested to know about this clinical aspect of the pharmaceutical preparation related to the liver pathologies and the clinical administration. In case if it is, you can drop me a message later. We can try to discuss on that particular concept. It's a very small concept anyway. But anyway, the fourth treatment protocol, what we do usually in most of these pathologies, either conditions of our body, including the liver, or the Shoto Vidhal Chikitsa, which is also been explained in the textbook. So in Shoto Vidhalakshanas, you have some emergency managements wherein you have some cirrhosis of the liver, you have the acute hepatic failure, chronic hepatic failure, acute or chronic hepatic failure. So all these conditions, possibly you people have come across all these things by now in your classes. So these are the pathologies wherein you need a very choosy drug. You need to have a pinpointing drug which acts on Shoto with the Chikitsa. You should have some Shoto with the Chikitsa, it's emergency management. Or else it is going to transform the patient's health condition into a total deterioration as early as possible. Why? Why it becomes so deadly, especially whenever it is related to the pathologies of the liver? What happens there? What is the problem which is happening there? So the problem there is actually, what is the liver related to? Raktavarshotas. So what is the chief function of the Rakta in the body? You have the reference of it in the Samhitas, wherein he explained Prinanam Jivanam Le Posne Hodarana Purne Garbhodpadasha. So you have that reference. So Rakta is a Jivana Adhara. As per this reference, Rakta is a Jivana Adhara. And for that, the Moola is the liver. Due to some reason, the person is having Rakta Pitta, the person is having some bleeding tendency, the person is having some injury, then he is supposed to have some problem related to his liver. He is supposed to have some problem related to his liver. That is a Shroto Vidhal Chikitsa, wherein you need some emergency management to resynthesize the liver. Emergency management wherein you can build up the functioning of the liver, wherein you might need, because it is something like a Marma Vigata, where you need some Chikitsa, where you can protect the organs as early as possible. As early as possible. So therein is a condition where we are extensively using the Hemagarbha Potali, we are using the Tamragarbha Potali. Many of these drugs are being used in such clinical pathologies, wherever we have the Shoto with the Chikitsa. So I have come across with certain case reports as well, wherein you can see how best the patient will respond by administering these kalpas in this particular format, because when this slide becomes the basis for the whole of my presentations, because based on this I try to manage most of my patients. They are very much fine by this particular maintenance. The added to that, what we need to do, general maintenance, is Deepana, Pachana, Anulomana. The next comes the Rasayana. So these are the four concepts which you need, by which the person is at least 75. The person is fine at least by 70% plus healthiness. In case if you are able to give to the patient with Deepana, Pachana, Rasayana and Anulomana, he is healthy, at least from more than 75% of the illnesses. Other than some external traumas and all, there are different units. Or else you have most of the conditions, and these conditions are very much related to the liver pathologies. In case if you are able to give these combinations which are related to the liver, wherein he has Deepana, Pachana, Anulomana and Rasayana, and all of them are being very commonly seen with the Rasaushadis. All the basmas, whatever are being prepared, are in the form of putas, where you have the Agni Sanikarsha. Because of the Agni Sanikarsha, the Agni Tattva is the essential component of the basma. So all these Agni Tattvas becomes an essential component in all the Bhasmas, and all the Bhasmas as per the textbook are said to be Rasayana. That is the reason why it is called Rasa Shastra, Rasayana Shastra. It is a whole subject related to the Rasayana system. So that is the reason why you have Rasi Bhavanti Lohani Suravandite. You have a reference for that. So all the lohas, all the dhatus, all the mineral or metallic substances used in Rasa Shastra are rasayana in nature. So you have attributed it. You have given samskara, put a samskara there, by which it has inbuilt the Agni Tattva in it. So Deepana Pachana quality has become an essential component. And all the components are having their Guru Guna. All the components are having that Guru Guna, which has been altered during the Sanikarsha, Agni Sanikarsha. You convert it into Lagu Guna. So only thing which you might not have with the Rasaushadhi to a major extent is the Anulomana Kriya. So what you need to do, try to see that always you tag these Rasaushadhis with some Anulomana substance. Then the treatment is complete. In case if you are able to do it, the treatment protocol is totally complete, because they themselves has a Deepana, Pachana, Rasayana, Dojavardhana quality. Only thing is Anulomana substance is essential. You can mix it up, some Avipattikar Churna, Bodanti Basma, whatever it is, and try to see that you have a Brudu Anulomana or Tivra Anulomana depending on the patient condition, and see that these drugs will take their role to play in the whole of the body. So this is how we are supposed to manage with the various levels of the treatment protocols whenever we discuss about any of the cases. Any of the cases. Today I am discussing only about the disorders of the liver, but this can be thought of with any of the cases which can be brought up into the presentation. So with this particular module, we can go into the first one. We'll just run through the slides of Rasava Shrotas. So Shrotas Mula, Rasava Shrotasam, Rudayam Mulam Dashadamanya as per Charaka. Rasavahetve Dvayor Mulam Rudayam Rasavahinyasya Damanyaha. This is as per Sushruta. So always try to see that you have the Rudaya and Dashadamanis or Asavahi Damanis. So whenever you have the conditions like the portal hypertension, try to see that your drug should have its equal action on the liver as well as on the heart. Because the dhamanis here, what you have, are being the moola sthana for the Rasavarshotas, wherein portal hypertension they are being affected with. And they are being related with the heart because the pressure exerted is because of the heart pumping, and the reflection is in the liver. So two molas are being affected. Rasa and Raktavarshotas mola is being affected. So any of the clinical pathologies of this kind, you are supposed to have some drugs which acts on Hridaya, which acts on Ekrit. You need to have some drugs which acts on Rasavarshotas. You need to have some drugs which acts on Raktavarshotas. Never neglect this protocol, or else you might have the treatment to be extended in the patient. He will get right, but it will be extended. So this is the importance of Rasavarshotas. So when you see the Dushti Lakshanas, Shroto Dushti Lakshanas in Rasavarshotas, these are the various Dushti Lakshanas like Ashraddha, Aruchi, Asavairasya, Arasagnatha, Rullasa, Gaurava, Tandra, Angamarda, Jwara, Tama, Pandu, Shrotasam, Rodaha, Klaipya, Sadaha, Krushangataha, Nasho, Agni, Ayatakala, Valipalita, Rasapradosha Jarogaha. This is as per Charaka Sutrasthana. Shoto Vedalakshanas, as explained, of the Shosha, and also the Pranavaha, Vidhava, Maranam Tatlingam. So he dies immediately. So this is very important phenomenon wherein the person will have an emergency management. Whenever you read this particular shloka, don't you think all these features are related to the modern liver? Don't you find that Ashraddha, Aruchi, Asavairasya, Arasagnatha, Rullasa, Gaurava are much related to the liver pathologies today? Whenever you have a patient suffering from lack of appetite, anorexia, like conditions, don't you give them with the drugs which are acting on the liver today? You have a very popular prescriptions, Arogyavardhini. Even from the patent side, you have something like Lu52. So there are hundreds of such prescriptions. Whenever you have such pathologies, the drug selected is of the liver. Why? When you are strict Ayurvedic norm, you are supposed to give some drug which acts on only Rasavarshotas. Why are you planning for Raktavarshotas? So, whenever you are treating with the Rasavarshotas, always keep in consideration with the Raktavarshotas, because both of these two dhatus move alike. They mix together and they move around. So that is the reason you need to consider both these Shrotasas as important phenomena, and they are being very much interrelated in the body. So the treatment protocol, as explained in Charaka Vimana, is a Langana, Lagu Ahara and Vihara. So whenever you have here the Rasava Shutus is being related to the Twak. Twak is called as Rasa. Am I audible now?